Kaduna State's 2025 budget allocates 127 billion naira to the health sector, which is 16.07% of the total budget. The authorities say this level of funding is necessary to upgrade healthcare facilities, procure medical equipment, expand mobile healthcare services, ensuring that no community is left behind in accessing quality healthcare.
We cannot turn around the economy of our state without enhancing the health of our people. Our vision is to build healthy communities where the poor and the vulnerable have access to quality healthcare.
Kaduna State is addressing key public health issues by prioritizing its 290 primary health care centers spread across the state.
Medicines and equipment were distributed to our primary healthcare centers in Kaduna State will be given to children from first year to up to 6 years free of charge. Nobody will ask them for anything. All our pregnant women will get these medicines free in our primary healthcare centers. Our vulnerable population, those that are vulnerable, will also be given these medicines and services at the primary healthcare centers free.
This upgraded facility, established decades ago, is one of many aimed at bridging the gap in healthcare delivery.
A lot of effort we are putting ensuring that we ensure that our people have access to healthcare both at the primary level as well as secondary and tertiary level.
Today I'm here to find out how this center is redefining healthcare access for thousands of people under the Ubasani-led administration. I'm welcomed by Executive Secretary of the Kaduna State Primary Healthcare Board, Bello Jamo, who takes me on a tour of the facility. He speaks passionately about the state's investment in a robust referral system that ensures seamless care from primary to secondary health institutions.
Since this is the prototype high-volume PHC in Kaduna North, there is a robust referral system to tertiary hospital and secondary, which is Barodiko as the tertiary, or Yusuf Danzo, another general hospital. So whenever she refers, whoever there sees her referral, they know that it's a continuum. The phenomenon of having to wait promptly, there is no need to have to wait in the reception or to register. It will be attended to as though it was an integral part of that system. So that's the robust referral linkage, primary to secondary.
Basically, I kind of reduce the burden for the secondary and tertiary centers. It's a primary healthcare, so it's basically like a sick bay / first aid. I supervise, I screen, I review to see the emergency cases that can be handled at a higher tertiary institute or teaching hospital, and the ones that can be managed here. This center, it helps a lot because there's a lot of burden in healthcare. So if they go to places like secondary, tertiary, all these teaching hospitals, it's difficult for them to be seen on time because they will concentrate on the emergency cases.
Yes.
So sometimes even picking the emergency cases and the cold cases, I take that time to do that. So it reduces the work. So there's easier care and faster care here. If it's something that is beyond our power, I send them directly with a referral. And with that referral, they can see a doctor easily as opposed to sitting in the waiting room and waiting to be reviewed and screened because I've already done that here prior. So basically here we just do, since I'm here, I can hydrate. I can deal with all these emergency cases that will not make it to the next center, like shock, or someone that has like a hypertensive crisis. Once I've given that first crucial treatment, I send them for follow-up care, at least so they can see a specialist depending on their care.
Okay. Then what's the preponderance of the cases that you address here?
To be honest, I've seen a lot of cases from your basic malaria to preeclampsia to some serious bad cases that need to be seen and addressed. But people that come here usually, what makes people come to this place is that it's easier to access health care.
The center's accessibility makes it a vital lifeline in their community. During my visit, the center's role became clear. Little Hawa Abubakar arrives in distress after a scorpion sting.
expand. So that
At the laboratory, pharmacist Halima Garba praises the government for improving drug availability. The labor room, though quiet, now sees up to 40 deliveries monthly. Yet, midwife Zainab Musa notes a challenge.
You know, some people, even after the antenatal care, some women will deliver at home. They just come in the morning and tell you that they are already delivered. But
Without
outcome.
without being attended to by a medical professional.
Yes.
Wow. So, in a month, for example, on the average, how many women do you deliver of their babies? Yeah.
It depends, but we can get 30
in a month. As I round up the tour of this facility, outside I observe little Hawa, now stable, cuddled by her dad. The quick treatment she receives underlines the critical role of centers like this in saving lives by providing timely care. The improvements in this old facility demonstrate Kaduna State government's commitment to matching its word with action when it described healthcare as a right and not a privilege. The primary health center in Angwanshanu, Kaduna North local government area is relatively new. This facility provides a lifeline for many, offering essential services to meet the community's growing healthcare needs. From the Zakaria Isa Primary Health Center located in Magajingeri area of Kaduna town, I am now in Angwanshanu, and there's another primary health center here. I still have to help me with my work the Executive Secretary of the Kaduna State Primary Health Care Board. Is going to be taking me into the inner recesses of this primary health center in Angwanshanu so that we can see what our people need. We can see what the government needs to do to improve on health care delivery in Kaduna State. So come with me. Thank you once again. I took off from the female ward, where patients receive dedicated attention. Among them is a nursing mother recovering from low PCV and another being treated for diarrhea. Family planning takes center stage at this unit, led by Furere Jumari. She explains how long-acting and short-acting contraceptives are offered, with implants and injectables being popular choices. She also talked about contraceptive implants, demonstrating their use. Okay.
Yes, instead of them coming after every 2 months or after 3 months. So they prefer to come back after 3 years or 5 years. Yes, when they take that.
What is the success rate for the long acting, or what do you call it?
Active,
long
yes,
acting.
TIN.
Success rate as the number of clients.
No. Success rate in terms of effectiveness.
In terms of effectiveness, it's like 98% effectiveness.
Okay.
So it doesn't feel, honestly. Yeah, it doesn't feel.
Okay.
Complications?
It depends on individual. What this one might have might be different from individual differences. That is the only thing. And they are mild. They are not serious.
Okay.
At times it only comes with bleeding. So after you explain to them, normally when you introduce something new into the body, at times you have that kind of reaction, but not everybody. It depends on the individual. And when they come with treat, that is all. So it's mild.
Thank you.
What of husband's participation in your experience? Do they encourage the wives to present?
They do. With the present economic situation, they are those that even pushing the women to come for it. And it's family planners. And it's not like before. Before they have to take consent of their husband before they come, but now it's not like that. They have their own rights. Even without the consent, they can do it. It's allowed. But before, you cannot do it to a woman except her husband permit. But now, even if he doesn't, you have the right to do it. Only that she just sign the consent form for you, then you are covered.
No, we are all facing the reality.
Yes,
All facing the reality.
So we did. They are the ones that even sending the for.
The men, ba?
Yes.
Because we are the ones who bear the burden, so. The immunization center is one of the busiest units, with mothers arriving daily to have their children vaccinated against deadly diseases.
We give booster dose of measles. For the 9 months, then we give them a booster dose. By then we discharge them and tell them to come back at any time they had that there is a campaign.
The center's commitment to vaccine safety is underscored by its efficient storage system, ensuring vaccines remain potent. Field volunteer Bala Abdul monitors vaccine availability and tracks high-priority diseases like polio and diarrhea.
We come and see if they have availability of vaccines.
Okay. And if they don't have enough, what do you do?
We call CCO immediately and report to him that so facility don't have so antigens. They have so.
What is CCO?
Cold chain officer.
Huh?
Cold chain officer.
Cold chain officer. Okay.
And then we look at their data. If there is discrepancy between tally sheets, summary sheets, we make correction.
From family planning to immunizations and emergency care, Kaduna State Primary Health Care Centers are more than a facility.
President of the government of the day, whereby they have rehabilitated and upgraded most of our facilities now. So people will feel that they have seen a place where they can access healthcare services within their own community settings.
72 kilometers from Kaduna's bustling state capital lies Zaria, home to the Isa Chikaji Primary Health Care Center. A 14-bed facility serving thousands of residents in this ancient city. The World Development Committee chairman emphasizes the need for residents to prioritize primary health centers for medical care.
I checked in to see if they have challenges to do with the community. When they brought him in, I think he couldn't walk. We had to back him. And before they could bring the wheelchair, we had brought him in. So it's good to see that at least now he's very okay and he's talking by himself, and he can attest to that. He couldn't talk, and the relatives that brought him in were very agitated. So, but then these are the few challenges we have at the community level. And being community persons, I believe the primary healthcare board are relying on us to be able to educate our people and make them aware that there are certain challenges that must not necessarily leave the primary healthcare level. So you don't carry typhoid or malaria to that level unless it becomes serious. So, and people don't know this, they rush to the secondary or even tertiary facility and choke up these facilities. So, but then we're doing our best. When we have our monthly meetings or outreaches, we tell people, when you have these things, come to the primary healthcare. We know there's a level beyond which we cannot go at the level, primary health level of care. So gradually, I think our people are gaining that awareness. It will take time because this was not done in a day, so it will take time before they grasp what actually needs to be done at the primary level of care.
What really was his opinion?
When he came in, normally I think when they bring them in, what I know we do at the facility or they do at the facilities, they take the normal vitals and then they send him for test. I think after the test, I had them saying immediately they did RDT before the MPS. They confirmed he had malaria positive, and then they wanted to do the Woodall test to confirm he had typhoid. So they did all that and they were giving him palliative treatment for the malaria. So subsequently, I think you can see now they admitted him, and I'm sure he has spent less than 3 hours here. He's comfortable. Yes, he can talk and he's good. So
the community health officer reveals that the labor room sees 53 to 60 deliveries each month. For newborns with breathing challenges, the resuscitation plan guides the staff, supported by tools like the Neo breath bag.
This is a neonatal corner where we resuscitate a baby in case the baby has asphyxia. Then we bring the baby down here. We cut the cord from the mother. Then we bring the baby down here. We use the ambu bag So where we check for the functionality of the ambu bag, then we place the baby and then turn the head of the baby, we use the action plan and check. The baby is not crying, then we clean the baby, we clear the airways and stimulate the baby. If this baby is still not crying, that is when we use the suction device. How is the suction device? So that we can still use the suction to suck all the fluid inside the mouth and look at it. Clean, we fix it here. This is the pendulum. Then put the penguin inside the baby's mouth first and suction out all the mucus inside the mouth. Drop it down inside this bulb. Go into the two nostrils. Do the same. Then place the baby. Use the abdomen and sustain the baby. Put in the air into the lungs. Up to 40 breaths per minute until maybe the baby gets pregnant. Follow all this action plan. So we train more than 400 healthcare workers on how to sustain the baby in the field. This is the new breath. If the baby is a preterm baby, like those babies, so we use this, the new breath. We put it on the, we want this new breath has already been open. But if it is okay, we put it inside and then we warm it for 40 minutes. Then we put it inside the bag before we refer this baby to the secondary health facility for further management. This is where we put the baby inside the new breast cup. Because this one will be warm, so we put it inside here, and then we lock it. Then we put the baby here. Then we cover the baby, put the baby on the chest of the mother down to the secondary health facility for further management. We'll put this baby into the incubator. But if the baby is normal and there is no any medical condition, then we teach the mothers they can do mother care. You can see the pictures there. Teach them how to put the baby from the chest of the mother in between the breast. We cover the baby with the wrapper and then put the pap and then the stockings is only Pampers. If you keep the baby.
Wow.
Yes, always. 24/7 the baby will be there. And I trust you until when the baby reaches up to the normal weight, 2.5 kg and above.
Okay. So she mentioned referring to the secondary facility. Here we don't have an ambulance, but under the Kaduna State government system, we have what is called ETS, Emergency Transport System. So we have people in the community who have dedicated their vehicles and their time free of charge. And then we have people from the National Union of Road Transport Workers who have their vehicles on standby 24/7. So if we call the closest one, they will come in and convey the client to the secondary facility free of charge.
In emergencies, the center relies on the community transport system to ensure uninterrupted vaccine storage and electricity. Solar panels power the facility, a statewide initiative by Governor Obasani replicated across 255 centers. At Isa Chikaji Primary Health Center, the blend of community effort and government support is reshaping healthcare delivery in Kaduna State, one patient at a time. Due to some of these strides, Kaduna emerged as the best performing state in the northwest of Nigeria at the 2024 Primary Healthcare Leadership Challenge, winning $500,000 for exceptional healthcare investments. Deputy Governor Dr. Hadiza Sabuwa Balarabe received the prestigious award at a gala hosted by the Nigerian Governors Forum in Abuja. This recognition highlights the state government's commitment to strengthening primary healthcare and the relentless efforts of Kaduna's health team. Malnutrition is a significant concern among children in rural Kaduna, as I discovered in this primary health center in Kachia. I observed the high prevalence of stunting and underweight. Officials here are enlightening the locals on how to feed their children. They are also distributing the ready-to-use therapeutic foods given to them by the state government to treat children with severe malnutrition.
On supervision to see how the children are faring, and we have them today. They are here to receive their RETF, ready-to-use therapeutic food.
Okay.
Yes.
So
They have started receiving the RETF. Sooner or later, if she continues, it will turn to green.
So you will have added weight.
Sir?
That means you will have gained weight.
Yes. So it will reach up to 12.5 to 30.
So all of them here, all the children here now,
They are severe malnourishment, but they have started gaining weight now. They have changed now. You can see all of them, they are smiling. Even the mothers, they are smiling.
So they are gaining weight.
Yes, they are gaining weight.
Zaidu, Baka da Alame. Okay.
Muna muku godiya. A lokacin da na fara karɓar abincin nan, yara na sun fara mai da jikinsu suna yin kyau. Amma kafin fara karɓar abincin gaskiya ka gan su wani ka san su. In ka gan su abin tausayi. Amma yanzu kowa ya gan su ana sha'awar ma a ɗauka musu. So lokacin da suna ciwo, in na zo wurin nan kama ba za ka sha'awar ka tabe su ba. Amma da an fara bani wannan gaskiya yara na yayi kyau. Domin yanzu ma suna rarrafe ko ina. Ɗaya ma gashi ya yi haƙori.
Under the leadership of Governor Obasani, 6 of the state's 32 general hospitals are being remodeled and reconstructed to deliver improved healthcare services to residents. Beyond this, 9 hospitals abandoned for more than 20 years are now undergoing a complete overhaul. Earlier this year, I visited Kachia General Hospital. So much work was being done by artisans who took the task seriously. So you can see workers, they are busy here. The remodeling is on. Well done. Well done. Patients need a very conducive environment for them to achieve quicker recovery. And that is what the government wants to achieve by remodeling this hospital. Canada Sako, okay, wajen gwamna.
Sakon da nake da shi shine gaskiya aikin da suke yi nan gaskiya mun ga alamun cin gaba kan aikin. Kuma da ba mu da aiki nan gaba mun san za mu iya samun aiki a nan. Tunda mun ga aikin dai ga yanayin aikin ba wai karamin aiki bane, babban aiki ne. Muna sa a zuciya za mu iya mu samu aiki nan gaba a nan, tunda aikin ba wai karamin aiki ba ne.
Ya kaga aikin nan?
Aiki ya kyau gaskiya. Aiki ya kyau. Kuma gaskiya ana yin aiki mai kyau. Wannan gwamnati abin zamu sai wata mun gode Allah. Mun gode wannan gwamnati. Wata. Saboda gaskiya wannan aiki tun zamanin shagari ba samu wannan aikin nan ba. Sai wannan karan. Mu kuma ma'aikatan injiniyoyin da ke aiki su gaskiya muna jin daɗin su.
Kuma ya daidai kuna bukata.
Yawwa, da muna bukatar aiki titi. Ba samu ba. Ashe yanzu Allah ya kawo mana shi cikin sauki, ba cikin wahala ba.
3 months down the line, the hospital is wearing a new look.
So seriously, a lot has been done, thanks to our governor, Senator Obasani, and the president. I know how this facility was. It fell into a state of total disrepair. This hospital was almost dysfunctional before this initiative came. And like Dr. Megari said, the reality of it is that when I entered here today, I couldn't recognize this place.
The administration in Kaduna State has been so focused on complete remodeling of health institutions in the state. Primary health centers have been rebuilt in some cases, and the secondary and tertiary institutions in the health sector are not left behind. Behind me is the General Hospital, Kachia. The governor demolished it, and he has put in place new structures within the premises of the General Hospital, Kachia.